Hello, and thank you for joining us. My name is Dion Brown. I'm a registered nurse, and I am currently attending Liberty University. I wanted to say thank you, Velma, for allowing us to use you for the servant interview. This basically is a course that I'm taking to pursue a master's degree in nursing, but this class basically has given me a new insight on leadership. So I wanted to choose Velma, which is my clinical coordinator here at VCU, and she's just earned her master's degree, so I appreciate you taking the time. So welcome.
You're welcome. You're welcome, Dion, and I appreciate the fact that you would even come to me and ask me. I'm honored.
Absolutely. All right. So we're going to get right down to it. We're going to start off our interview questions. And I went through the questionnaire and I've selected 5. And I'm going to start off. Velma, what is your definition of a servant leader?
I honestly think a servant leader is a person who actually uplifts another person through a sense of commitment and love. And the love I'm talking about is that Christian type of love that the Bible speaks about. It's without any kind of judgment, and it's with you'll be treating someone the way you want to be treated. Right. It doesn't come. It's a tall order, and so it doesn't always comes with a good emotions from people. But as long as you have a sense of consistency, I think people will respect you for it.
Right, right. I agree. I think we all do the best we can as nurses to try to, give everybody the care that we would want to have. So that is accurate. As far as you being a leader, what are some of your personal leadership strengths?
I think I'm a person that empathizes a lot. I feel for people, but I still maintain my own identity. So there is some kind of boundary there, although I will do what is necessary to make the other person comfortable. I also think I have a sense of genuineness. I am consistent in my behavior, and then I will also treat everyone the same as a leader. Don't give any special ownership to anyone. That everyone is treated the same way. I think that also I know I try to meet the needs of people and not necessarily their wants. Because sometimes as a leader that works in an institution that have rules and regulation, it has to be what the employee needs and not necessarily what they want. Because wants may conflict with policies and procedures.
Absolutely. I just want to reiterate and piggyback off of that. I do feel like one of your strengths, which you do have a lot, is that you are able to educate us often. You go to me above sometimes, and you want to look and see what the rationale is behind things. You're able to articulate it in a way, and you do capture a lot of attention by being able to educate us. So I think we all agree on that. Moving along, as far as yourself as a servant leader, can you give us an example, and you can use more than one, of your ability? I just mentioned that she's a great educator. To show this trait, to show your servanthood, and what things you've done to be able to show us your, superiors, things that you've accomplished in these last few years, to be able to say that you are a servant leader.
Okay. As you said, I think I focus. The thing about uplifting others, I think, comes strongly in this setting with actually educating people. So I strive, I think, as you said, that I've gone above and above to educate the staff. The way I do that is to make sure that they're on committees. right? I also encourage them to do their certification, and then I'll go ahead, or even to actually go on to do their bachelor's or master's. I know that this is actually mirroring the actual goals of the institution, but I think organization goals also become unit goals. And I find that once someone is educated, they'll also be empowered. And I think that's one of my job, to actually empower the staff so that they can make good decisions, you know, and decision on their own, actually. So I've gone through and you know, and develop program for them to do their certification, and with much encouragement, I think that I've taken people, not just talk about it in meeting, but take them one-on-one, to tell them how beneficial it is. And I know sometimes I may take things to heart, but you know, it is such a desire in me to see people grow. It really is. Yeah.
Well, that's a part of, in my opinion, I'm not in a leadership role, but I think being able to allow people to grow and not, you know, hindering growth based on, you know, a personal opinion or whatever. You have to see people's strengths, and you have to acknowledge their weaknesses as well. So I think that is a very good trait to have. And just going back to that question, recently, just, you know, and how have you been able to show that to your leaders, your superiors? You have presented anything recently?
Well, you know, leaders of the organization, because it's also education is one of their strategic goals, and we are a magnet institution also. You know, there's certain requirements about how we need to educate the staff that work with patients so that it can be safe. So that's always a question. That is something that we actually track. How many staff members on your unit that has gotten their certification in a period of time, in the past year or what? How many staff members have attained their master's, you know, or their bachelor degree? So as I say, you know, we have to take the organization's strategic goals, and then we have to make it become a unit goal. And it's how the leaders on the unit, like myself, take what they want and actually put it into action. You know, because I could very well say that the organization have this goal, but do nothing about it. Correct. You know, there have to be that genuine desire to uplift someone, else it won't be successful.
Right. I agree. I definitely agree with that. The next question basically is, when you do see that there is a need for change, or there is room for improvement, or there is room that we could grow in, how do you handle the suggestions and feedback when negotiating changes in a unit? If you agree with them, how do you handle them? And if you disagree with them, how do you handle it?
I think one of the traits of a leader cannot be a yes person, right? One of the traits is that you have to be what I call intentional, right? So therefore, you're gonna feed through or look through what the staff suggests, and like within this setting, if it is not meeting organization policies and procedures and things like that, then you have to say no to them. You understand? So you can just, you know, you're not gonna please everyone.
Right.
So for example, we have, you know, scheduling is always a bone of contention, so to speak, with staff. You know, staff we have our personal life and we have our professional life. So I've never actually worked in an organization where, you know, everyone is 100% pleased with their schedule.
Right.
So yes, we do, as much as you see that we do self-scheduling, so to speak, and allow staff to put in what is it that will work well with their family, right? But on the other hand, we do have a business to run or a unit to run, and if I go ahead and I have to be strong about that, go ahead and give everybody exactly what they want, you understand, then sometimes they wouldn't have enough staff to actually take care of the patients. I, however, understand the personal life, because anybody's professional life is akin to their personal life, and try really to meet whatever they self-schedule. And I know for a fact, and a lot of staff does not, new staff is not aware of this, but when I came over here, everybody used to work 5 days a week.
Okay.
Monday to Friday, because the organization, the leaders, so to speak, say to you that we are an outpatient and that's what we need to work. And I sit down and talk to my boss to let her know that, okay, well, this is, how do they meet their medical appointments? How do they meet, some of their family life? I said, personally, it is a challenge to me to work 5 days a week.
Okay.
And so what I sit down and do with an older staff member who are not here now, was to make a dummy schedule. With everybody getting, actually we start off just giving someone, one person 1 day off a week, because we didn't have enough staff to have everybody working 4 days a week. So we make that dummy schedule, we talk to the staff, and people start being off. You're off this week, Nurse B is off next week, right? Just to see how it works. And as we sat down and change our grid, our actual staffing grid, where we were allowed to, of course, with our superior, we were allowed to hire more people. So we start hiring hourly and demonstrated to our leaders then, well, we need more staff to take care of the patient. Then so it becomes where we were able to give more people 4 days a week instead of 5 days. So I think we have come a long way, and now it is our routine to actually have someone off 1 day instead of working Monday to Friday. But it has not always been like that. And so, and you see how much work went into it, actually proving to leaders that it can happen. And I think it brings staff satisfaction. So sometimes as leaders, we are behind the scenes doing a lot of things that the staff is not aware of, because we have staff meeting, but it's not every nitty gritty we can go into and tell them. But we do a lot of work to make the staff satisfied, because they have to be satisfied to actually for us to have patient satisfaction.
Yeah, and I definitely think that was an effort well worth it. It's not only for patient satisfaction, but it's for staff retention as well. So being able to prove that your volume meets a necessity for more staff, that's not easy to do.
No.
Based on, the amount of patients that we can encounter, them having adequate staff here, including nurses and care partners, it makes it a lot easier, especially like you said, for doctor's appointments. People do have lives, so that definitely means a lot to me. I do, recognize that I can have a day off here and there, and that does make a big difference. So this last question, I felt based on all of them, meant a lot to me, because I'm always looking for ways that I could make someone else see something I do and may influence them in a better way. I do try to live my life in a Christian way, and I know that I'm not perfect and nowhere near perfect, but at the end of the day, I want to know, what did I do that might have helped someone else or helped a patient? So as far as your role, being in leadership, could you give me some examples? And you named some already, but just kind of elaborate on what in your role do you do to empower others?
I think, as I say, the most important thing that I can do, because really the individual have to empower themselves,
Okay.
but I have to, as a leader, give them the opportunity to do that. And as I said, I think one of the things is to really make sure that the staff is educated so that they can make decisions. The other thing is that, and once they can get to make good decisions, they will feel empowered.
Mm-hmm.
The other thing I will do is that, I kind of like to do that shared governance where I will listen to people, and listen to the staff and take in consideration their suggestion.
Mm-hmm.
Most of the time I will put forward their suggestion, but at the same time I said I also have to be intentional. So therefore I have to make sure that the suggestion will not only work for them, but will actually work for the institution that they're employed in. So I think that creating an environment, to me, that encourage them to grow their skills, is the most important way to empower them. And that is through education, going back to school, obtaining their certifications, encourage them to participate in committees and encourage them to make decisions, like giving them autonomy. And one way to do that is to make them charge nurses.
Absolutely.
Not to use the role as I'm doing this and I'm doing this better at you. So I know, as right now for me, the charge nurse role is something, and I am working on that. That I need to make sure that role is being used in the right way, so that individual who's in the role is able to grow and also grow others.
Okay.
Yeah. So that is a project that I'm working on, and I'm looking at the evidence surrounding that. It may be that I may end up with just 2 charge nurses.
Mm-hmm.
You understand? Until I can do further growth with others.
Okay.
And not just anyone being charged.
Right. Okay.
So that is an area of growth for us, in which I recognize. And as a leader, you go around and you not only hear from the staff, but you do your own observation, which is very, very, very important. Yeah.
Awesome. Well, I really appreciate you letting me in on that piece of information, and I do hope you get all the evidence you need to actually make that transition. I do want to thank you. It has been a pleasure. I actually enjoyed this interview more than I thought I would, but I appreciate you taking the time out. Again, Velma Davis.
Thank you, Dion.
Thank you.
I enjoyed the interview.
Have a good day. Bye.